talking about the CNAs today and the important role that they've had during the pandemic and kind of moving forward. What role can they play? Can we elevate them? Next slide. So their job, giving compassion, care, and love, right? It's been harder during the pandemic, and they've needed to do these things to a greater degree, right? Because they're dealing with more confusion from the PPE, isolation. They're scared, they're anxious. The dementia's gotten worse. They're not having family visitors who help control all these things. And so I think it's just added a lot of stress and more important role for the CNAs to play to help combat all of this. Next slide. So how do we keep a positive mindset and everybody during the pandemic? There's certainly been a lot of stress, anxiety for everybody, not just healthcare workers, certainly, but I think there's a brunt of stress on healthcare workers, frontline workers. And CNAs are definitely that. And so how do we keep them positive? How do we keep them lifted up and doing self-care? How do we show that our gratitude for all the work that they're doing, all the extra emotional effort they're putting in? And how do we support them? What can we put in place to help keep things positive and not fall to burnout? Next slide. So they're the frontline, they're the people in there taking care of our patients, spending the time with them. They have the eyes and ears to see the first symptoms, the first to note that that a resident is sleeping more or complaining of fatigue or more confused. And so they can be the eyes and ears and the first to alert us of these small changes. So can we elevate them to be our expert noticers? Noticers is what we've called them, right? Can they be the expert observers to alert us to the first signs and symptoms that need to be elevated down the line so that we can test and isolate and treat? Next slide. They need to communicate. They need to feel comfortable to voice their opinion and voice their observation. So how do we give them the strength and courage and the ability in that their observations matter, right? So we need them to be able to feel comfortable in elevating the things that they see in their observations. So we need to educate them that the slightest changes can indicate an outbreak is brewing on all of the symptoms that we've talked about going through all these echo visits, right? That our residents have different symptoms. It's not necessarily the loss of taste and smell and the cough and the shortness of breath, but we're seeing the delirium, the confusion, the falls, and those can be the first symptoms and the only symptoms that our residents have. So we need to educate our CNAs to know to look for these things and to communicate them and elevate it onto the nursing staff and so forth. GI complaints, stuffy nose. Delirium can be both the hypoactive, where they're sleeping more, or the hyperactive, where they're more agitated and having psychosis and those kinds of things. Next slide. So we need to have a good relationship with the team, doctors, nurses, CNAs, all throughout we're a team. And so we got to enhance this communication to make all members of the team feel comfortable giving their reports. There are some websites that can help find ways to enhance this communication, and we'll give you those in emails. But next slide. So they need to bring professionalism. They are professionals, and they need to be able to respect family wishes and help with providing dignity and integrity to our residents, to maintain confidentiality, to help guide expectations and decision making at end of life and help to promote science and treating the right way. Next slide. And our CNAs, they develop strong relationships with the residents. They become a family member often. Often there's the trust. They're the person that is trusted in the team of care providers, right? They're the ones providing the direct contact, the physical, spiritual, emotional, friendships, and family support. Next slide. And they're often the ones that are there next to the patient, providing all the support, especially right now when families haven't been able to be in there at end of life. They've been the ones who've been acting as family and support systems, and who are in contact and providing the whole hand holding when we're going through end of life. Next slide. So certainly their job has been more challenging, like all of ours. And it's like we discussed earlier, they're more confused for many reasons, isolation being one of them, the PPE, and if they have COVID infection, they're certainly more confused. There's a higher burden of care because the isolation has caused decreased movement. Decreased movement is causing, there's more bed sores, there's more soiling, there's weakness, there's having to increase help with transfers because of the weakness. So all of this from isolation, depression, worsening dementia, cognition. And I mean, just like we're tired of PPE, they are dealing with it room to room. So certainly exhaustion from the use of PPE. So it's hard during the pandemic, and we have to recognize that it's hard for us. It's hard for CNAs. It's got to be triple hard for them with what they're dealing with every day. So next slide. And they've seen more death, right? We've all seen more death. And that's hard. It's hard to deal with. We have to be talking about that. We have to be talking about end of life and how it makes us feel and how do we get through. We have to go through the mourning for our residents as well, just like family members. So we have to help the CNAs go through that. They're dealing with additional ADL needs. And like I said, all the things we've talked about, the care, everybody's requiring more care right now, more emotional care, more physical care. And some of these post-COVID symptoms are going on forever, the long haulers we've talked about. And certainly it's caused a progression in memory and thinking. So lots of added challenges. Can we lift them up? How else can we lift up our CNAs, especially in work with our quality improvement? And there's certainly pros and cons to this. They're working with the residents, they're part of the team. I think we found pros to be that there's increased job satisfaction and a reason to promote people to be involved in these things. They do probably have a lack of training, so we have to put in the time and training. They don't have time because they're trying to take care of the physical needs of the residents. So where can we get the time for them to help with quality improvement? And can there be resentment among staff if somebody's chosen to do this and others aren't? So definitely pros and cons. Next slide. What are some of the barriers? Lack of curriculum or ways to educate and train in quality improvement. We don't have the mentors to help do that training and monitoring and continuing education. And then there's no structured time for this. So those are certainly barriers. Next slide. So what are some qualities we can look for in residents that we can take forward as quality improvement champions? Obviously, people who care about and embrace education and learning and elevating knowledge, the ones that are always trying to improve, the ones who do well navigating relationships and who help and always choose to be the mentors of people we're onboarding, the people who are comfortable with communicating to those nurses, physicians, and the whole team. And the people who are advocating for their patients and communicating well, they'd be good choices to help to come on board as the quality improvement champions. Next slide. So there have been some studies on using CNAs in quality improvement. And you can see those studies here. And basically, it's produced 50% improvement in quality metrics in the Canadian study, and that they can become peer-to-peer mentors for implementing change. So there are studies ongoing, and we can certainly start studies if we want to check these things out. But I think it appears that they're a good place to start, and that we should be elevating them into our quality improvement. Next slide. So how can we improve CNA handoffs regarding resident care? And there's a Seattle study here, and I don't know if Dr. Juravich has anything else to add on it, but they created focus groups of the RNs and CNAs together and developed protocols for reviewing electronic medical records and doing one-to-one bedside rounds with the RN.
Yeah, just to jump in, that study was a smaller study. It was done, I think, at just one facility, but the idea was that the CNAs were not fully informed of all the diagnoses of the patients that they were dealing with, and so nor were the handoffs working as completely. And so what they found is that by having the CNAs do chart review on the residents that they were taking care of, and then adding that to a one-on-one meeting or a handoff or huddle with each resident really improved care by 50% by all their metrics. So it was pretty impressive.
All right. Next slide. So again, just reference to some other studies done on empowering CNAs. There's some programs out there, Team Talk, Team Steps. And I don't know if you've ever worked with any of those, Dr. Juravich.
Sorry, yeah, no, I had to get my mute off there. I've not used that, but one of our facilities cited the Team Steps program, and I think that's been circulated in one of our, we can send that out again as a mechanism for debriefing.
Okay, next slide. What about initial and ongoing training of CNAs in QAPI? There's some web-based resources. Next slide. And I think when we go on to the video here, some of this will be brought up as well. Can we give them quizzes to match column B with column A? To help them to educate and see where their knowledge lies. Next slide. All right, so quality improvement. Here we go, video.
Welcome to QAPI for Certified Nursing Assistants, Making a Difference, presented by Health Insight Oregon. What is QAPI? During this short presentation, you will learn to define QAPI, your QAPI role, and how QAPI benefits nursing home residents and staff. But first, meet Louie. Louie is one of many nursing home residents cared for by certified nursing assistants just like you. You work hard providing him with quality care in the place he calls home. Louie enjoys bird watching. Watching birds outside when he was younger and from his apartment window as he grew older is what made Louie happy. You've gotten to know Louie and see that watching birds can make him smile. It's important to his quality of life. So every day after lunch, you bring Louie to a window in the lobby. You feel comfortable that Louie is safe doing something he enjoys while you continue working with other residents. You are rightfully proud of providing excellent, person-centered care. But one day, the lobby is suddenly full of activity and noise. Oh no, everything happens so fast and Louis falls. Luckily, Louis is not hurt. A report is written and his doctor and his family are notified. Of course, his family is concerned about the fall and want to know if Louis can safely continue his favorite activity. You are concerned too. What happened? You remember all the activity and noise just before he fell and wonder if it played a part. You report what you noticed to the nurse, and this information is included in the report. The nurse suggests you also report it during QAPI rounds. But wait, what is QAPI? Right now, your nursing home is tracking information about how care is provided and comparing it with national quality standards. That's quality assurance, or QA. But care can be made even better by identifying and carefully acting on areas for improvement. That's performance improvement, or PI. Quality assurance, QA, plus performance improvement, PI, together make QAPI. Nursing home residents are always at the heart of QAPI. Improving their quality of care and quality of life is what QAPI is all about. Your workplace may already have a QAPI plan in place that reflects your organization's mission and values. Staff should follow policies and procedures which support QAPI efforts. What does that mean? How do you support QAPI? You are already supporting QAPI by reporting opportunities to improve care. QAPI just takes that reporting to the next level. Your report about Louis' fall will be compared to other information to decide if this problem needs special attention. In this case, complaints about noise happen frequently. Residents and their families are concerned that noise from staff and televisions affects sleep. Staff is concerned that noise levels can make it hard to concentrate and communicate. Now it appears that noise may have contributed to a fall. Falls increase the risk of injury, both for residents and for staff. So how can QAPI help? Here's how. QAPI uses teamwork to solve problems. A special team is formed to work on the problem you have helped to identify. This is called a Performance Improvement Project, or PIP team. You are part of the team. PIP teams pull together staff from multiple departments and can also include residents and family members. Why is that? That is because QAPI always focuses on the systems that are involved and not on individuals. Systems? What are systems? A system is made up of two or more parts working toward a common goal. Nursing homes are a kind of system. Different parts or departments work together with the goal of providing resident care. For example, certified nursing assistants and the Department of Nursing Services are one very important part of the nursing home system. Nursing services, in turn, work with other departments or parts of the system, which all come together to provide resident care. But systems can be tricky. You can't always see what's going to happen when parts of the system overlap. To prevent a fall from happening again, it will be important to include all the parts of the system that may be involved. Which departments were involved here? Did you identify nursing services, the maintenance and housekeeping departments, and office staff? Each of these departments is included in this PIP team. During team meetings, everyone listens and everyone learns from each other. In the end, your team agrees. Noise reached a tipping point and contributed to Louis' fall. Now the team brainstorms about the best possible solutions to prevent such problems from happening again. Suggestions include adding noise meters and educating staff about the health effects of noise. Other suggestions include scheduling housekeeping and maintenance during times when residents are not using the lobby, and turning television volume down at night. The goal is to decrease complaints about noise throughout the unit where you work. Your team expects that with these changes, complaints about noise will decrease. Your PIP team plans carefully to put the project into action, including who will be involved, what resources are needed, where it will take place, when it will occur, and how it will be monitored. So what happens next? Your role, as always, is to be accountable for your own performance. That means supporting the Performance Improvement Project as it is carried out. and supporting others as changes are made, because change takes time. During this time, some on your team will collect information to learn if your PIP team is meeting its goal. In this case, your team learns that complaints about noise are decreasing. You are proud to report back to your leadership that, thanks to the Performance Improvement Project, Louis can calmly and safely sit and enjoy bird watching in the lobby after lunch. You can be proud that you help make a difference using QAPI. Let's review. How do you make a difference with QAPI? You make a difference by learning about QAPI and by actively participating in QAPI. First, what have you learned? You have learned that QAPI places residents at the heart of care, looks at systems, not individuals, and involves all staff and residents and family members in problem solving. How do you participate? What is your role as a certified nursing assistant? You participate by reporting concerns that affect resident care and quality of life, by contributing to PIP teams, by supporting QAPI projects and QAPI policies and procedures. But what's the benefit? Why QAPI? The benefit for nursing home residents is decreased risk of injury and error, better quality of care, and better quality of life. The benefit for nursing home staff is also decreased risk of injury and error, increased workplace participation, and increased job satisfaction. You are making a difference. Remember, certified nursing assistants like you provide essential hands-on care where you work. You are in an important position to make a difference with QAPI. QAPI needs your eyes, ears, and voice. Thank you for taking the time to watch this QAPI learning activity today, and thank you for helping to make good care even better.
All right, so I'll let Kelly take over if you're ready.
Yeah, absolutely. I actually have a couple of comments about that video. You know, I was thinking, you know, the CNA participating on the team really will save a lot of time for everybody, in the sense that when that family member comes in and they see the CNA more than they see anyone else and says, "Did you know my dad had a fall? What did you do about it?" And easily that CNA would be able to say, "You know what, during our team meeting, we discussed why he had the fall. We did an investigation. We determined that noise was the issue, and these are the steps that we put in place." So opposed to the CNA going, "I don't know," having to run to the director of nursing, and then the director of nursing or the administrator, the ADON, doing all of the follow-up with the family, the CNA's answered that question immediately. It also builds the confidence of the family in the staff, because they are actively participating in that group. So I think that when we think about CNAs and line staff having to pull them from the floor to participate in quality improvement, seems like we're taking time away from their duties on the floor. In essence, you will save time on the end, because they will be more involved and be able to respond appropriately to the family members as well as their peers. "Hey, by the way, Mr. Jones fell today. This is why he fell. This is what we talked about." And they can be support for one another in moving forward. So anyway, I really like that little video, and that was just something that popped into my head whenever it was going through. And before we get before we get started on this presentation, there's just a couple of areas I wanted to touch on when I was listening to Dr. Dahl's presentation. You know, CNAs, there was one part she said about developing a strong relationship, the CNAs, and when a strong relationship with residents. And when possible, and I think I've mentioned this before, if you could allow the CNAs those few more moments to spend with residents, because they do have such a bond with these residents like family, then it doesn't only promote that emotional stability with the residents and the staff, but it also allows them the opportunity to see those change in conditions. If the CNAs are in and out real quick, just providing that ADL care, they may not notice something small in a change of condition. So those little moments, once again, they may seem like more time on the front end, but then you can maybe recognize those change in conditions because you're taking more time with them. So that was something that popped in my head while we were going through that participation as well. And then on the Seattle study, it was showing that huddles or handoffs had improved the quality of care. And if we can take time to do huddles for care issues or handoffs, then I think there's an opportunity to use huddles to also do for some of the quality improvement stuff. We just got to be mindful about how that's being scheduled and make sure that it can fit within the day. So anyways, those were my couple of comments. We can go ahead and go to the first slide. We're doing things a little bit different this week, and what we're going to talk about is how to determine an area of improvement using quality measures. We're going to do an interactive root cause analysis activity, and we're going to do that based on the CNA participation in quality improvement. And then Allison from Rosewood has agreed to present an audit QI tool that her facility is using. So first we'll go to the next slide. Right. So quality improvement begins with determining and or identifying an area of improvement. There's multiple ways to identify an area of improvement, but one of the ways we're going to talk about today is quality measures. But you can look at survey deficiencies if there's complaints from families or employees, if you pick something up during your rounding process. And I would love if anyone has any other ideas that is always an area that you pick up improvement possibilities to chat it in, just to share with your peers. It may be something that they're not necessarily looking at that would be helpful. So we'll look at the quality measures. The next page, perfect. Thanks to Michelle, she pulled quality measures for our cohorts that are participating in the ECHO project. And what I did is I just took the average of the facilities in the cohort compared to the average of the states that are in the cohort, and then the national average. And so pressure ulcers overall seem to be lower within this cohort than they are statewide and nationally, which is good. But as you see, the ADL care triggers higher for a lot of facilities. So if your facility triggers high on any quality measure, it's an area to look and see if there can be an opportunity for improvement there. Also, we look at UTIs. UTIs trigger a little bit higher. I know I've discussed with some of the facilities I'm working with, and I may have mentioned on these calls before, but it's always a good idea to go ahead and review any infection type areas. Since the hyper focus has been on COVID right now, some of the other areas may not have gotten as much attention and therefore could be triggering now when they haven't in the past. When we look at UTIs, generally we're looking at, is there good hydration, or is pericare done appropriately? Well, part of pericare is hand hygiene. So are you up to date on your hand hygiene observations in relation to any PIPs that you've put in place? So just an idea of how to look at your quality measures and compare to your state and national average. Obviously, you want to be below those numbers when possible. And there are some situations where it's going to be higher. If we look at antipsychotics, for instance, on quality measures, you may have multiple people, say, that are bipolar that are on antipsychotics, and the psychiatrist or physician deems it appropriate. But because bipolar is not a recognized diagnosis, they're still going to trigger on that antipsychotic, right? So as long as you know what the reason behind it is and are making good faith efforts to do those reductions, then you should be okay. But if you're unaware of why these are triggering, that's an opportunity to really do a root cause and determine what is making these numbers go up. A couple of areas that I want to talk about. I'm gonna put something into chat for you in just a minute, but I wanted to touch base on the regulations that are out there regarding QAPI. You know, with the rules of participation, there's been 3 phases that have been rolled out, the last one being November of 2018. And we do talk about PIPs in that phase. Now, I know with COVID that it kind of all got slowed down some, but it's still something that is coming down the pipe that they will be looking for in the future to make sure that you do have PIPs in place for any of these areas for improvement. And in essence, I think nursing facilities always have worked on the concept of we're going to put interventions in place to improve an issue. But I don't know that we've all done the monitoring following those improvements going into place. And then also making sure that we really figure out what the root cause of the issue is to determine how to plan out that quality improvement project. But I'll put in the chat the most current link for the state operations manual. And I know whenever I was in the facility, we used to call it the watermelon book, but now it's online. And so the most current version is 2017, but at least this link hopefully will be updated more frequently than probably the watermelon book that I used to call it anyway. So now we're going to go to this root cause analysis. And the idea behind this is that everybody kind of type in some suggestions or comments on why what you believe the root cause issue of CNAs not participating in QAPI is. This way we can all kind of share ideas with each other. And I think Michelle's going to share her screen and she can kind of type in live while we are going through this activity. And I'm going to pull the chat up. Oh, there it is. So we can see. Can you all see my screen now?
Yes.
Okay. Michelle, I'll have you kind of help me with the chat while we're going through this. So what do you guys think as far as people goes? What would you say an issue with the CNA's lack of participation in QAPI? It was something that was mentioned on the video, and I also had down on a note is lack of understanding of QAPI from the CNA's perspective. And I would be curious too from the participants on systems, so your Relias or whatever your system is, do you have a QAPI module for your CNAs to complete or your line staff to ensure that they understand the process? I think we all can probably agree lack of time on the CNA's part to participate. Lack of time, says Julie. Yeah, I think that that's definitely an issue. And you know, when I think about time, CNAs participate in care plans, and there's a way for us to make time for them to participate there. So you have to really just look at scheduling and such to make sure that there's an opportunity for them to participate in a performance improvement project. And when we talk about time, I think it's very important that there's always an agenda or a schedule of what you're discussing in these meetings, so it doesn't exceed the time that that it needs to, so they can get back on the floor to carry on their duties.
And I'll just add in there, Kelly, just to re-emphasize how you mentioned a couple of times that putting in that time at the front end, getting those CNAs involved in it, can really help reduce some of the time in later on. You know, if your CNAs have that good understanding of what's going on and the relationship with the family, you may eliminate those arguments and concerns and loud discussions and potentially lawsuits and those kinds of things that can come from family not always getting the information that they want in a timely manner.
Absolutely. And adding another note here too is that the CNAs don't feel empowered to participate because their role hasn't always been to participate in programs like this. So It's about encouraging them and empowering them to help make those decisions and participate. That they don't understand the importance, absolutely.
Great, Carla.
And I really, that video that we watched today, I really like it because it breaks it down to something that is relevant to the CNAs, to understand how their participation would be beneficial, because there are the CNAs are the ones that usually witness a fall. They usually know what triggered that fall, because they're more familiar with a lot of the day-to-day activities of those residents. So their input is vital in that process. And you know, whenever you do a fall incident report, you usually have a witness statement if someone, you know, witnessed the fall, which is typically the CNA. And so they are participating in some sort of brainstorming activity to determine why they fell, because they're participating in the incident report by completing a witness statement. So I don't think we're at the point where they're not participating at all. It's just that they're not participating in full. What other ideas do we have? Maybe they don't have access to the, you know, the definition of the QAPI. Maybe I can't type today. They don't have access to the QAPI information. Maybe there's nothing on their training programs that defines QAPI. And maybe just the term QAPI in general is scary to them. And that's something that, to break it down more simple, would make it easier for them to feel like that they were participating. Jean, Faye, do y'all have any ideas we can add?
The two key thoughts that I had in mind were understanding the why, which you've already captured under understanding the importance. All too often, I think CNAs are asked to do something different, but not with an explanation. So in other words, they don't truly understand why they're doing it different. When they are well informed, they understand the why and understand the future goal of that change. I think it really increases compliance.
Yeah, absolutely. I would agree with that. And you give them a checklist. You need to do A, B, and C, but I'm not going to tell you why that's important or how it's going to benefit the resident or you. I think that the CNAs, when they can see the progress or the benefit of their actions, then they're more likely and will feel more empowered to participate. You know, in the very beginning of this program, we showed that big whiteboard. It was a COVID unit at a hospital. It was saying, we've done this in so many days. It's a similar concept whenever you're trying to show the CNAs their benefit. Hey, you participated on this performance improvement project. This is where we started. This is where we are now. And it's because of your participation that we were able to continue to improve the quality of care for residents and their quality of life. And I think that whenever we talk to CNAs about participating or adding any additional duties, it just to them is, oh, just more time. I don't have enough time in the day as it is to check off everything off my list. But if we start having better systems in place through QAPI or through performance improvement projects, it will ultimately save time in the end. But unfortunately, that's hard to see because it's not an immediate gratification. Does anybody have any other thoughts that we can do? I've made some notes here. One is that they're not experts in a particular area or in the area of quality improvement or QAPI, because that's not something they have done before. And I think that goes for any individual or any employee, is if I'm not an expert in what I'm talking about, I may be more hesitant to talk about it or to participate in it, because I don't want to be felt like people people are judging me, saying she doesn't know what she's talking about. So encouraging them to really learn it, promoting them to understand that no idea is a bad idea, and it's something that we just have to continue to go through the process. And I think that that's important. I know we talk about education and understanding QAPI, but really encouraging them to learn how to do it. And a lot of things you don't truly understand how to do until you start doing it. And so just communication on that part. What else do we have? Anybody have any other ideas? I don't see anything else popping up on chat.
I'll just throw in there, as far as systems sounds so sophisticated to me. And like, I don't have anything to do with, the systems that are happening, but even something as simple as like the agenda that you were mentioning is, having a consistent agenda and sticking to the time frame that's allotted for that is making a systems level improvement. We always stick to that. We can get back to what else we need to be doing. Sometimes those meetings have a tendency to get off on topic and we're talking about everything else related to a certain individual, but we need to stick to what the agenda is, get in, get out, and get on with our work.
Absolutely. I think that's a great point, Michelle. And I think that just goes for your systems in general within your facility. When your leadership staff understand, I'm going to the care plan meeting right now. I know we're going to discuss A, B, and C. It's going to be this long. We have someone facilitate the meeting so it moves quickly and get out. Then your leadership team is more confident in the system or that an agenda is going to be followed. Therefore, they're not going to be negative or naysayers whenever you're talking to the CNAs about participating in something. They'll say, hey, listen, I promise it's only going to be this long. This is what we always do. This is our program. Dr. Dahl, do you have any thoughts?
Oh, sorry, getting unmuted here.
Great.
No, I agree with everything that's been said. I think the biggest thing is, their lack of understanding or lack of value that they may perceive that they have to these kinds of projects, and how do we elevate that?
Absolutely. We talk a lot about small tests of change and quality improvement. And if you have, say currently you have 2 performance improvement projects open, one with a CNA on the team and one without a CNA on the team, and you really track the progress of those 2 projects, and you be able to show the staff at that point, listen, we had a CNA participate here and our success rate was so much more than this project where we didn't have a CNA participate. Or you can use a previous project you didn't have a CNA and just be able to show them the difference on this is why it's important. Here's the value of a CNA being on the team. And I mean, that's the same with a housekeeper, a maintenance supervisor, whoever it is, but to be able to show the value of the line staff participating on these projects will definitely get more buy-in, I believe, from the line staff to participate in the future. And maybe start smaller. If you have an all staff meeting and you have a particular area of improvement that has been identified, use that all staff meeting as an opportunity to do a root cause analysis with all staff. And then go back to those staff as you worked your performance improvement project, or as you're going through it, and say, you know what, you brought up this idea when we did that root cause analysis, and that is what led us to put these processes in place. Do you think they'll be beneficial? And then use that 5 attributes that we talk about all the time to see if they agree with that. And then you're really including them in that performance improvement project, and you're not really pulling them off the floor for them to participate in a sit-down meeting in the conference room, but they are still providing input, which is valuable to the completion of the project. All right, well, since we don't have any more comments, I will go ahead and move forward for time's sake. If Allison, are you still on? And I'm gonna stop sharing and let Sarah put your tool up. And as I mentioned, Allison is from Rosewood, and she has been utilizing a quality improvement tool, an audit tracker, and she has agreed to share with us today. While Allison is calling in on the phone, I was going to go back and look at the note that I was talking about, the policies and procedures, the state operations manual. I put the link in the chat. The quote that's currently in there, like I said, this is the 2017 version. It says, while facilities are not yet required to perform them, PIPs are a type of corrective action that generally involves team making a concentrated effort over time to improve a systemic problem. It often requires systemic investigation, such as a root cause analysis, to identify the underlying causes or factors which have contributed to or caused the problem. Interventions are designed to address the underlying causes. Once each intervention is implemented, the team closely monitors results to determine if changes are yielding the expected improvement or if the interventions should be revised. So ultimately, the program does, or the policies and procedures says we have to do all of the steps of a PIP, but it doesn't say you have to do a PIP until phase 3, which phase 3 was in November of 2018. So although it's not required to do a PIP, you still have to do the other steps basically of a PIP. So best practice, go ahead and do the PIP. And it's just an easier way to keep all of your information together and track it. I think I've mentioned before, I used to carry around a binder of action plans, and it was always my go-to as I'm rounding or whatever else I'm doing. I'm carrying this binder around and checking off that all of these interventions or steps have taken place. But what I wasn't doing when I was in the facility, I wasn't truly monitoring the progress of the interventions that I put in place. I was really just monitoring that the interventions were completed. So for me, if I ever went back to be an administrator, there's a lot of things I think I would do differently. But it's a good practice to just use the performance improvement templates.
Kelly, this
Yes.
is Allison. I got it. I got on Liz's computer here, so I got the mic working now.
Oh, perfect. Okay, Sarah, I'll let you move to the next slide. Thanks, Allison.
Yep. Okay, so this is the performance improvement tracker that we've been using since August. We have some audits that went back a little bit farther, but in August, we identified the 4 areas that we've really been focusing on, and that's the hand hygiene after resident contact, non-communal dining, which we haven't done every month just because with our numbers and the county, it's gone kind of back and forth between some group dining and then non-communal dining. So what we were looking at there is when residents were strictly eating in their room, were we doing the things we needed to do specific to that, since it wasn't something that we did normally. And then we also looked at PPE donning and doffing, and then wearing face masks and face shields within the care area and within 6 feet of other staff. So our goals for all of these areas was to be at 90% or greater with our compliance. And we've kind of, gone up and down in our compliance, meeting our goal and not meeting our goal. And so we try to focus on the ones that we aren't meeting our goal of 90%. What are the things that we could put into place that would help us to meet that goal and increase our compliance in those areas? So on the bottom portion of this tracker is a place for us to add those mitigation tactics that we've put into place. And so we would have
Next slide, Sarah.
have a discussion about, what things were not getting done, what things were barriers to being able to do them. And then the next month, then we would again audit and see if we were meeting our goal. So some things that we have really focused on is especially most recently was sanitizing our equipment. And that one is not on here. So I think we must have added it after this one was updated, Michelle. But that's one we've been focusing on the last couple of months here, is making sure that the Hoyer lifts or the PAL lifts or the vitals machines, when they're going into a resident room, are getting cleaned when they're leaving before they would go to another resident. And so we used a tool to kind of audit that, and that's a stamper with a black light. So we could stamp the equipment and then go back at a later time to see if the stamp was still present. Then that indicated that the equipment wasn't wiped down properly. So we've had some struggles with this. What I noticed is that the staff were wiping it down, but they weren't necessarily waiting for the proper kill time or contact time. And we found that the wipes that we were keeping on the equipment were kind of different, varying times of contact. So we decided to go with a 1 minute contact time on all of the machines. So that way it's the least amount of time that they have to wait. And I think that that was one of the things when we talked to the CNAs about this, is that that they were wiping it down. It just would take a long time if they had to sit there for 3 or 5 minutes, depending on what the wipes were. And so we'll be re-auditing that area, all of them, but specifically looking at that one, focusing on that one because we hadn't been meeting our goal there. And so we've done some different interventions just with not being able to meet in large groups too. We've had to kind of offer more meetings for our CNAs so they could be in smaller groups, just like our routine monthly meetings. And we're also trying to do like small group huddles where we can get them together, the CNAs and the nurses, and discuss, you know, what it is about that particular area that we can look at to make changes and try to increase our compliance there.
That's awesome, Allison. See, you're involving your CNAs and line staff in your quality improvement.
Yeah, yep.
In this last page here that we're showing right now is just this tracking tool that I did put the link for in the chat. The tracking tool automatically pulls everything into run graphs for you. So you can plot it out and actually show your staff, you know, where we're going up and where we're going down. It's good for the QAPI team. It's good for your board of directors, for anybody that you want to be able to share this information with. It very quickly shows you if we're getting better or not.
Awesome. That would be great for us to be able to use, go back and review with the staff too.
Again, Allison, for sharing today. I think this is a great tool. And as Michelle mentioned, as soon as you put the data in, it automatically populates on a graph. And that's a good visual to share with your staff. When we talked about making sure that they understand the value of what they brought to the program, in Allison's case, she said she's been doing huddles with those staff to discuss some of these projects. And whenever they do the huddles, they could show these graphs and say, look, this is when we started doing the huddles to discuss this project, and we've increased since we've been having these huddles, or something to that extent. You know, you talk about the equipment sanitation, and something that came up is it was the dwell time that was a concern. And that may not have been something that you guys knew if you weren't doing the huddles with the line staff who are the ones actually sanitizing. So good job to you and your team. I think this is a great tool to share.